Hello and welcome. My name is Jill Morgan. I am a nurse here at Emory University Hospital in Atlanta, Georgia. We're going to start this webinar in just a second. And we're going to talk about PPE from A to Z, exploring the latest standards and regulations for healthcare personnel. We're going to be talking about updates in liquid barrier protection, specifically to the kinds of textiles that we use in healthcare. So gowns, drapes, things like that. So if you're not familiar with NETEC, we're a partnership for preparedness, setting the gold standard for special pathogen preparedness and response across healthcare systems in the US with the goals of driving best practices, closing knowledge gaps, and developing innovative resources. We're going to talk about resources a little bit more later. And NETEC is made up now of 13 facilities across the country in all of 10 of the HHS regions, from the Northeast all the way across the country. And we're happy to have a few of those NETEC resources here with us today. And I'll do those introductions in just a second. And the regional contacts are here on this slide. So some of the things that NETEC offers, first of all, consultations and assessments for helping facilities better prepare their entire facility, from HVAC through PPE and training and education, how to look at your own readiness and getting feedback from NETEC experts. We also have education and training, things like today, in-person courses, online trainings, a lot of them with free CEUs, and we have customizable exercise templates for disaster preparedness and special pathogens preparedness. We have a research network building around a central IRB for the rapid deployment of clinical research protocols. And we're developing international partnerships. So we're not the only people thinking about special pathogens and their preparedness. So we have a bunch of international partners that are sharing these concerns and their best practices. So, as I said, I'm Jill Morgan. I work here at Emory University Hospital in Atlanta. I'm joined today by some really great folks from across the country. First of all, in my own backyard is Jill Holdsworth. So Jill is the Infection Prevention Manager for Emory University Hospital Midtown. And probably more importantly for today's stuff is that she has a really broad range of experience in healthcare, but is also the co-chair of the Protective Barriers Committee that helped put this standard together. So we're really excited to have Jill with us today. We're also going to have Brooke Henriksen, who's my co-lead for the NETEC Personal Protective Equipment Working Group, and she is out of Providence Sacred Heart in Spokane, where she leads their biocontainment unit. And we're going to have Caroline Pearson in the background, who's going to be helping us from Denver and answering some questions. And she's got a great background and really has been involved in special pathogens care since nearly day one here, and leads the folks out at Denver Health. So thank you guys all for being here. I'm super excited about this conversation. I know we have a lot of things to cover today. And I just want to say, I feel like we start with sort of an alphabet soup. So I understand that acronyms are really useful and we use them all the time. But we're going to try to do our best to sort of spell things out today, to go through what we mean by some of the terms we use, and really try to break this down into some digestible pieces for the healthcare workers who are on the receiving end and trying to make use of these standards. So again, put your questions in the Q&A function. We're going to go through and have some time for questions at the end, but I am going to turn it over now to Jill Holdsworth and let her tell us a little bit more about this new PB7D standard. Thanks, Jill.
Great. Thanks, Jill, and welcome everybody. Thank you guys for joining us. And like Jill said, I'm the co-chair for the AAMI PB committee, which stands for Protective Barriers. And the reason that I'm here today, and I get excited anytime that I can talk to any group of people about the new standards that we released just at the beginning of this year. And if you're unfamiliar with them, that's okay, because that's what we're going to kind of go over today. The Protective Barriers Committee spent the last 4 to 5 years updating these standards, and we released this update at the beginning of this year. And what I'm going to do today is kind of briefly go over what I think is most relevant to this topic. There's going to be a lot more that I'm not going to go over today. If you are unfamiliar with this standard and your facility doesn't have a copy of it, I would go ahead and ask if this is something that someone has access to or that you can have access to, but we're going to go over a lot of the highlights today, at least the big ticket updates, at least that I think that everybody should know if you're somebody that uses PPE in your healthcare facility. So go ahead, next slide. Okay, so this is just kind of an overview of what is PB70. If you haven't heard of it before, you don't know what AAMI is, all of that's okay. Let's do just kind of a broad summary. So if you've ever heard of AAMI ST79, AAMI ST71, this is just another one of those standards documents that comes from the AAMI ANSI organizations. So this is the protective apparel standard that goes over a lot of things, but also it doesn't cover some things. So I want to make sure that we understand the things that it does go over, and then we'll go over the updates, the new items in just a bit. So we are talking a lot about surgical gowns today, but we're not going to be talking about gloves, patient exam gloves, and other medical gloves. We are not going to be talking about things that are for the face and the eyes. These are the exclusions of PB70. And so these are the things that I know there are some questions already that were coming in about these, but these are the things that are not included in this standard. We're also not going to include other types of absorbent materials that are used in the OR, though it does include drapes. It does not include things like OR towels and things like that. Okay, so one of the big things that a lot of people do understand are the levels of AAMI gowns. You may have heard that, especially if you work in somewhere that does include like the OR, sterile processing, or anywhere that has an AAMI rated gown, you may have heard something called like AAMI level 3 gown, AAMI level 4 gown. So the labeling requirements in PB70 are very important. So it does include this device labeling, package labeling. And so this is where some of the updates are going to come into play and become very important. So one of the updates, and I've kind of got it laid out here with some of these updates, we have made it to where it must be very clearly labeled on the package and the gown what type of gown that you're wearing. Some of the issues in the past have been, for example, a gown that appears to have a back to it. So the gown is covering your back, but it's actually non-protective. So what we would call that is a full coverage non-protective back gown, but can be very confusing to the user because they think that because the gown goes all the way around them, it's protecting them. But in all reality, it doesn't protect them at all in the back. But if the label doesn't clearly say that, then they don't know what they're actually choosing. And so that is why PB70 is so important for the end user, which a lot of us are, to understand. And I'll say this a couple times that PB70 was originally meant for manufacturers, and it was originally written for manufacturers. But as we continue moving forward with these AAMI committees, we are pushing that more end users, more folks from the nursing floors, the ORs, and places that are using PPE are involved in writing these standards so that people like me and you can read these standards and make the most informed decision about what type of PPE do I need to use for X situation. And one of the things that we must have to make that decision is a properly labeled garment. So if I don't know what I'm choosing, I don't know what AAMI level it is and what an AAMI level means, then I'm going to have no idea what I'm supposed to be choosing. So the package labeling is important. It needs to clearly say this is a full coverage gown, a non-protective back gown, or an open back gown. Hopefully you could tell if it's an open back gown or not, but you may not until you open it. So if it has to be processed, some gowns are reusable. It has to include very clearly what those are, inspection instructions, performance instructions. So all of those things are very important. And so one of the main sections is also going to talk about how the manufacturer has to provide this technical information sheet or the training on the barrier performance. So understanding where the barrier performance is going to have a critical zone, a non-critical zone, and I'll explain critical zones in a moment if you've never heard that term, and how the end user is going to be affected by that barrier performance. And so that leads to how can you anticipate to be exposed or not exposed while wearing this particular item. And so that's really important when you're choosing a gown for a higher risk situation. And I like to use the examples from the OR in sterile processing the best, because that's where you have a higher risk of exposure, higher risk of blood, body fluids, splashes. So you want to make sure that you're doing risk assessments and choosing what is best for you. And that's where you can also use an accompanying document to PB70 called TIR 11, and it will help you choose the right document or right garment as well. So this document kind of accompanies to operationalize this standard. And that's what the TIR documents are for, if you've never heard that term through AAMI. I'm going to give you a second to digest this. This is probably the most complicated slide when we educate on AAMI PB70. There is a lot of testing that goes into the critical zones of gowns. So when you hear level 1, 2, 3, and 4, and you wonder what does that mean and what makes something a level 1 versus a level 4, there are different types of tests that go into each of these levels of gowns, and they have to pass certain types of tests. So you can see here that level 1 is tested for a certain level of water resistance, but level 4 is tested for that resistance to a bacteriophage. So you have different levels of things that have to pass, and it gets harder and harder and harder. So this is where you also have to test on those critical zones, on the seams, on specific areas as well. So just take a look at this for a second, take a look at this chart, and you'll kind of understand a little bit more about how it's more protective the higher the number that you get. Okay, now I'm going to just go over some of the types of barrier performances. This is sort of what you just looked at, but in a little bit simpler of a way. And this is exactly how it's listed in the PB70 document. So when you look at level 1, it's going to list all of these things, the gowns, drapes, protective apparel, and it's going to just list out in a narrative form with how these items are tested. So you can see there, it talks about the surgical drapes are tested the exact same way as gowns, which I always found quite interesting when I first started looking at this stuff. And it's water resistance and that impact penetration. And then you go down to level 4. And again, you've got the same kinds of things that are listed, but now it's tested for the liquid resistance and viral penetration. So you've got the different testing, and it's also going to be tested for that bloodborne pathogens and the penetration tests. So lots of differences between 1 and 4. And this is something that's going to help you test what are you looking for, what is the level of protection that you're looking for, how much water resistance and impact penetration do you need. And one of the things that I don't really go into here, but when I'm talking to a sterile processing audience, one of the biggest changes that we made with AAMI PB70 was we added a lot of types of gowns. And one of the changes we made was putting a category in called a decontamination gown. So if any of you work with sterile processing departments, there was never a specific standard for decontamination. So we added that as a category and are now requiring as a standard that decontamination areas in sterile processing must use at least a level 3 AAMI level gown, which is completely appropriate for the type of work they're doing. And if you read the testing that must go on for an AAMI level 3 gown, this is for the team member safety and everyone's safety that's going into the decontamination area, if you're familiar with that type of work. So a 3 or a 4 is compliant per the standard. And these groups sometimes don't even get the right type of PPE for the work that they're doing. So now they do have to abide by this standard. And this should really help keep those team members a lot safer moving forward now that it's written into a standard. And looking at this, you can kind of start to see what critical zones are. If you've never heard of this term before, you can kind of see what is a critical zone, what might be a critical zone. So what I'm showing you here is actually something new. So the first figure here on the left, B1, is your standard surgical gown. So for a surgical gown, you're going to want to have in the entire front of the gown as a critical zone. So this is going to need to have a higher level of liquid resistance and impact penetration testing done, as well as that the darker there on the sleeves. Those are your critical zones for a typical surgical gown. What we did with this update was we came up with an additional type of surgical gown called surgical gown E. And this isn't limited to surgical areas. The E stands for extended coverage. So this can be used for any purpose, but the reason we did this was for situations that required additional coverage because of more splashing, more bloodborne pathogen exposure risk, for whatever purpose someone felt like they needed this. Now, to keep in mind, this just came out at the beginning of this year. So manufacturers are just now working on decontamination gown labeled items, surgical gown E labeled items. So you will not see these quite yet. I know some manufacturers are working on these, but I have not heard of anyone actually coming out on the market with these yet, because these are brand new designated items. But the surgical gown E provides a lot more critical zone coverage, as you can see on the right, because of that potential higher risk of splash or exposure. So this is something that I imagine maybe an orthopedic case might want to use in the OR, or something that a very wet patient coming in with an infectious disease, you may want to consider something like this if it's the first thing that you could have on hand. So just understanding your risk assessment again, and where might you want to have a surgical gown E? Where might you want to have a decontamination gown? And then you also have things called isolation gowns, procedure gowns, and other items that are listed in this PB70 document. And understanding where those all fit in is very important. And that's where understanding this document, the TIR 11, and your risk assessment are very important. And what are you currently using? And I think that was something that I went and did immediately after this came out, is I went and looked in the OR and sterile processing first to see what kind of AAMI level gown that we were using. And, what are you using in your hospitals, on your clinical floors? And is that enough? Is that what you want to be using? So those are takeaways that you can have today, just to know what you're using, and making sure that we're continuously educating each other on what this means and what we should be doing. And this is the first annex in PB70 that lets us know, why do we make changes and what are they? So this talks about the rationale. So the last version of PB70 was in 2012. And like I mentioned, there were only a few categories of gowns. And like you can see here, it says surgical gowns, surgical drapes, and isolation gowns. And that's all they had in that version. So we really expanded that so that we could make sure that the end users had exactly what they needed, and that we added all of these different types of gowns so that you can make the best informed choice to be safe, protective, and in that you had what you needed for the task that you're doing. And you weren't just lumping everything under something called a surgical gown or something called an isolation gown, because one size doesn't fit all when you're talking about bloodborne pathogen exposures and blood and body fluid exposures. So now there's procedure gown, decon gown, protective gowns, non-protective back gowns. And that's where now you can do your risk assessment and really determine what is best for this task and really fit your workflow and operationalize the PB70 standards into your workflow. And so again, understanding the tasks, the risk, and the standards all go hand in hand, and making sure that you're doing all of that and educating yourself, which is partly what you're doing here, is very important. And the labeling requirements, I think, are going to make that a lot easier. The previous version didn't have quite as much labeling requiring in it as we do now. So the new labeling requirements are going to make it very clear to the end user what they're choosing, what they are putting on, what they're choosing it for. And again, like I told you before, if it's a full gown, full back, but it's not protective, it'll be very clear that that's what's being chosen. And again, these are some of the things that were added. So I didn't go over all of these, but I touched on surgical gown. E has the extended critical zones. The procedural gown category was added. So again, that was another one that was just kind of lumped under surgical gown. Decontamination gown was lumped under surgical gown in the past version. Protective hoods, togas, other protective apparel. So a lot of folks in the OR will use protective hoods and togas. So that is listed in this document as well, and where those critical zones have to be. And then we've touched on the labeling requirements. And just to kind of touch on this a little bit, these are the kind of a critical zone standard slide of just the other protective gowns. This is an open back gown, which again, your risk assessment has to kind of tell you if this is appropriate or not. So I always use the example too of sterile processing. Again, if you're doing a task where there's a lot of splashing for whatever reason behind you, but you have an open back gown on, this is not the gown for you or for that situation. So we need to make sure, again, you're doing a really good risk assessment with multiple people. If you're doing, an isolation and your back's never going to be to anything that might be splashing, then do a risk assessment and see if that's appropriate. There is definitely a place for open back gowns in healthcare, but we have to make sure we're assessing the risk so that we're not splashing the back of us. Full coverage gowns obviously are going to protect us all the way around, but that non-protective back gown, I think it just gets confusing. So again, we have to just make sure we know what we're choosing, we know why we're choosing it, and everybody knows what they're putting on. There's a lot of folks that have no idea what they're putting on. They just grab whatever is there, they put it on, and they hope for the best. And the additional labeling requirements, I think I covered in one of the previous slides, but this is, I think, one of the bigger things that will help us, and we can help educate some of the other team members in our facilities, that make sure you look at what you're putting on and make sure you know why you're putting it on, and make sure you're putting it on correctly. I see a lot of team members that kind of put it on, they don't even tie it, they leave it hanging off their neck, but making sure that we're using them correctly and that we know which gown we're choosing. Do we have different options to choose from? But, just making sure that we're educated about the PPE that we have and that we're stocking the right gowns, the right PPE where we want it to be stocked. And those are things that we should check often, because I'm sure there have been times that some of you on the line have thought that you had this gown stocked in whatever department, and then you go back a few weeks later and it's a different gown, because sometimes your purchasing folks, your materials folks, they don't know that certain gowns need to be in certain areas. So we have to make sure that we're trying to educate everybody as much as possible, and especially so that they know that there is the standard document out here, and some places are now requiring certain levels of AAMI protection, but most of all, so that we're all protecting each other and keeping each other safe. All right, and just kind of in conclusion, PB70, like I mentioned before, it was originally intended to be used by the device manufacturers as they were constructing gowns and making gowns, and labeling the gowns. As we have progressed over the last 10 years, PB70 and TIR11 it's really kind of grown into something that end users can use, you can understand, you can start to make informed decisions by using PB70. And this new update that came out this year is really a lot easier to use as an end user. And yes, I know it a little bit better because I was the co-chair, but if you read it a few times, then I think that everybody can understand it a little bit easier as well. Understanding those protective properties of the gown can also be really helpful for everybody. And what I mean by that is understanding the critical zones of the gown that you're using. Also understanding what type of gown you're using. So, if you work in endoscopy, what type of gown are you using? Also, if you're working on a nursing unit, are you using a protective back gown or a full coverage gown or non-protective back gown? This is something that is probably a little bit of a shift for everybody, because we may not have really encouraged people to know that kind of information in the past. And again, the labeling requirements, the new categories, all of this is so we can make better decisions about the PPE we're using to keep ourselves safe and to really make us feel better at work, making better decisions, and so that we can be part of those decisions. I'll say it again, do a risk assessment, help use that risk assessment to make better choices. And also keeping in mind the exclusions for this particular standard. It doesn't cover all PPE. It is a barrier performance standard, so it covers a lot of things in depth, but there are also a lot of other things it doesn't cover. And so I think that's my last slide on all of this, but I'll be sticking around for the rest of the webinar. So happy to answer questions as we continue to move along. Thank you.
Thank you, Jill, so much. It's so nice to have somebody speak with such authority about something that I think for most of us is really very complex and new. I know that I knew a little bit about the level of gowns, but certainly not as much as I need to. So I want to kind of transition here, and we can go to the next slide. Thanks, Benjamin. You mentioned something about anticipating exposures, and I really want to just use that phrase to reintroduce Brooke Henriksen from Providence Sacred Heart in Spokane, Washington. And really, Brooke, I want you to just sort of tell this story because I think that this is so impactful, because we're making choices, but these choices have real implications, right? For what we do and how we do our jobs and the things we're going to be exposed to and potentially taking not just home, but like into the room or into the next nurse's station or down the hall. So, I think that this is a big topic that's really important, and I'm looking forward to our continued conversation. So I'm going to turn it over to Brooke Henriksen.
Thank you, Jill. And thank you, Jill Holsworth, so much for helping us navigate the PB70. It sometimes, I think, I'm a critical care bedside nurse by background, and I think a lot of the end users at the bedside, at least for myself, I'll speak for myself, was not aware of the different levels of gowns. So to have this knowledge and to really be pushing this education and information forward, I think is so important. And what I want to share with you is kind of my aha moment, where as I said, I was critical care. I was responding to a trauma down in our emergency department, and the patient was coming in, and we knew ahead of time that this was a pretty significant trauma. So we're all putting on our PPE, and we have those yellow carts that are next to our rooms, and we're digging through and we're putting on the PPE that we have. And I thought, okay, I know this is going to be a pretty messy trauma, so I'm going to put on maybe 2 pairs of gloves just to make sure, just in case. And I put on the yellow gown, and I'm talking about that yellow gown that's the thin material that's not necessarily woven. I put that on, and I had a moment of thinking, wonder if I need to put 2 of those on, but I wasn't sure whether that was right or not. So the trauma came, we're stabilizing the patient, and there came a point where we had to remove the C-collar. I held C-spine while we put in a central line. And the central line was difficult to place. So I ended up holding C-spine for about 20 minutes. And in that time, if anybody has held C-spine for a while, it gets a little, you kind of squirm and you kind of move and you kind of lean on the bed. And I ended up leaning on the bed, holding this patient's C-spine in place. And after about 20 minutes, I lifted up my arms and I had blood all down the forearms of my gown. And I thought, okay, well, I need to doff this before I spew that all over everything in the room, and doff my gloves, doff my gown. And my gown was it was level 1. So at the time I didn't realize this, but when I doffed my gown and I looked at my forearms, I had blood exposure all through my forearms, pretty much from wrist to elbow. And that was a huge aha moment for me to realize I didn't even know there was another opportunity for me to have, should I have done anything else? If I'd have known going in that my gown was not going to protect me from blood and pressure because I was leaning on the bed, that I was going to have this penetration of this bodily fluid, I could have done something different. I could have maybe taken a Chucks pad and maybe placed that around the patient's head, or leaned on the Chucks pad instead of depending on the gown. So my personal story is I'm hoping we can get the word out so that people can understand you may be limited to what you have access to in the moment, especially if you're in an ED or an emergency situation. You may know that you have different levels of gowns, but you may not have the time to get it. So think about the job that you need to go do. Use mitigation strategies. If you're not sure that the gown is going to cover you, do you have other fluid impermeable items? Maybe it's a Chucks pad, maybe it's a plastic backed absorbent pad that's disposable, but do something to try to protect yourself so that we can eliminate caregiver exposures. We know PPE is also for our patients, and we want to keep our patients safe, whether we're exposing them to anything, but we want to make sure that we're eliminating any potential exposures for our caregivers. So I think my little tidbits of learn from what happened to me, try to plan ahead. Sometimes when I would go into a large code brown, if I knew that the patient had a lot of diarrhea and they were not in contact precautions, maybe they had something else going on, use a gown, use double gloves, use extra Chucks pads. But I think we need to really try to, and I can't really say slow down because I haven't been that far from bedside, and I realize slowing down is not always an option, but I do want us to have the option to, or at least the consideration of, stop and think, how do I keep myself safe? How do I keep my patients safe? And we don't always know what we're walking into. So try to have an all hazards approach, so to speak, to what you're doing at the bedside.
Yeah, thank you, Brooke. That's so important. Let's just go to the next slide, I think, which is just our discussion slide. And then we can just go on to the next one. I want to bring back Jill Holdsworth. I want to bring Caroline Pearson on and really start down, hopefully answering some questions that we got both ahead of time when you guys registered for this webinar. We got quite a few questions submitted then, and sort of talk about risk mitigation, talk about these things about choosing and how we know what we've got in our supply closet. But I'm going to let Caroline kick it off, with a question. And if we can just go to that next slide, please. And we'll let Caroline sort of start us off here.
Thanks so much, Jill. And Jill Holdsworth, thank you so much for providing that robust overview and really giving us the details and the big takeaways about the changes to PB70. I'm an IP by trade, and I immediately start thinking about how am I going to take this information and implement it at my facility. When are manufacturers expected to start integrating these changes into their practices, and when will we see that in the products?
Yeah, it's a great question, because technically a manufacturer doesn't have to make a decon gown. They don't have to make the surgical level E gown. So I know that's only part of it. But we hope that they will. And I know a couple manufacturers that are making at least the decon gown, because we've been kind of chatting with them about the new requirements. So a lot of manufacturers are very interested, because they know this is a very needed thing, at least for the decon gown. And since this just came out, it takes a while for all of the testing to be done. So I'm hoping that at least by the end of the summer, early fall, we do start to see some of those decontamination gowns. For right now, what I've been telling people is at least make sure that the areas that are required to have that AAMI level 3 gown for decon, there are just AAMI level 3 and 4 gowns that they can wear to be compliant with the standard. So it's not that we can't be compliant without a decon labeled gown, but we can at least have an AAMI level 3 gown. As far as the labeling goes, it's hard to say, right when a standard drops that you have to be compliant with the labeling, because that's impossible. So really, when a new standard comes out, we manufacturers or whoever, just like as IPs, we at least have to have a plan So when I go to the APIC conference in a couple of weeks, I plan to start asking manufacturers what their plan is. I started doing it at the HSPA conference a month ago too. What is your plan to be compliant with PB70? Because it had just come out then, but now they've had a few months to think about it. And I want to start asking all of them and putting pressure on them, making sure that they do have a plan. Not that I'm a surveyor, but as an end user, I want to make sure that those things are coming and that they are planning on meeting these requirements, because they should be.
Yeah, I think that's great. And so I think a couple important maybe distinctions, and I know we went through a lot of details here, and I want to get to this importance of not just labeling the way the package looks, but labeling in terms of how something's called out, right? If something's called an isolation gown, then it has the same level of protection all the way around. If something's called a surgical gown, then it might not, right? And many of us probably have in our disposal, in our supply closets, our choices of an isolation gown, which might be, as Brooke said, a yellow thing that is not woven and that doesn't seem to be very protective, or we have surgical gowns in that special packaging, you know, the whole typically sterile, right? Well, I don't see many isolation gowns that aren't, or things that are used as isolation gowns that aren't sterile gowns. So just can we just make sure we're like communicating this correctly? Because I want to also make sure that some of the questions that have come through is like, well, how quickly could I grab a level 3 or a level 4 gown if I needed it? Well, you might have to grab a sterile one, right? Because that might be what you have. But you might be able to use some of the mitigation strategies that Brooke was mentioning about, like using a chucks. I don't need, if my risk is like where I have to lean against the bed, then maybe I don't need a sterile gown all over me. I just need something to protect that aspect of me. So just having maybe Jill and Caroline and Brooke for a second talk about that.
Yeah, and you know, that's one of the mitigation strategies that we will teach, is to use the chuck and kind of fold it against the bed and to lean against, so that you're not leaning against it, because that kind of strike through can happen no matter what level gown that you have, depending on the level of moisture that you're leaning up against and the force that you're leaning up against it with. So that can happen even you know, leaning against a sink. And so those things are important to think about, because you're right. I think in most facilities right now, the level 3 and 4 gowns are going to be in your procedural areas. So if you need it quickly, you're probably going to have to run to the OR, which is not going to be quickly.
Yeah, and I think that then it's knowing, okay, so what is in my supply closet? I mean, I guess if I were like a gamer, it would be like, well, what's in my quiver or what's in my backpack, right? Like, what do I have at my disposal that suits my skills and abilities and the risk I'm going to take on? So I want to know what I've got and how to use it, right? I think that was a really important point that was brought up is, you know, gowns aren't magic, right? This is not like a cloak of invisibility. I have to wear it right. It can't just drape down that as soon as I lean forward to the patient, I've got this big gaping neck. I want to make sure that I'm using it correctly. And that means knowing what it does and what it doesn't do. How someone would know the level of the gown that they might have on their supply closet or in their cart. There are a lot of unrated isolation gowns out there, right? So unrated isolation gowns doesn't mean they're not protective. It just means that we don't have a testing standard that they're measured against. And most isolation gowns are designed for keeping sort of those dry fomites off of us, right? That stuff that just gets churned around in the room when we walk into a contact isolation room. I know that there are several questions that I want to just try to get through today if we can. One of them is about like, are there things that we need to be concerned about that maybe aren't on PB70 that we would want to look for other qualities about? Like, flammability?
Yeah, and I knew that question came in ahead of time, and PB70 does not address flammability. Not that it's not an important quality, but it's not something addressed in PB70. So if that is something of interest to you, there are other standards that address flammability, but PB70 is not the standard that addresses that.
Yep, and that's something you should be able to read labels to know. So if you definitely know you need a flammable, inflammable gown, make sure you're looking for that and that your purchasing people know that you need to find those. One of the other things I want to talk about is really this idea of risk assessment. So Caroline and Brooke, thinking about how people can best anticipate risk. Do you guys have some sort of, I don't know, tips or tricks or I was also an ICU nurse for a long time, and I just assumed if I'm going in, even if I'm just going in to turn a patient, there's going to be poo there. You just might as well prepare for it before you go in. But how should people go kind of about their normal day and thinking about this?
I think at first, for the bedside nurse, I think that can be kind of a difficult question just because I feel like they're pulled in so many different directions. But I think it's so important. It is our responsibility to keep ourselves safe. It is up to us to try to foresee what we need to do as best as we can when we enter a room. So if you're going to enter that room because you're turning a patient, I would just kind of plan on, I'm going to expect there to be a surprise for me when I turn the patient. But I think that's also, it's a big question. I think it's hard to anticipate. I think we do the best we can, given our experience and given what we've seen. But I think it's hard to just say, this is what you need to do, and here's a step-by-step for how you do it. Nursing is, I can speak for that part of healthcare only, is pretty unpredictable. So you try to make the best choices you can, put on PPE, even if it isn't necessary. I mean, universal precautions are fantastic things, and I don't think they're used as much as they could be. I think there's still sometimes people go in the room even without gloves on because they don't plan on touching the patient, but then the patient needs something. And I think it's just kind of really being aware of, it is our responsibility to keep ourselves safe and to try to keep our patients safe and to decrease any potential contamination from us to the patient, but also from the patient to us.
Yeah, Caroline, can you kind of speak to this idea of, like protect first, or, however we can think about that?
Yeah, absolutely. Happy to, Jill. I think one of the biggest opportunities from an IP standpoint to do a risk assessment is, to round on your units and really understand what frontline healthcare providers are dealing with, and have those discussions about, what are you experiencing? What are you seeing? And here are some of the options available to provide that level of protection and to ensure that you're receiving the level of protection needed for the pathogen that you might be coming across, or the liquids that you might be experiencing. And I think, from my experience, that has been the most valuable from a risk assessment perspective. There are, of course, formal opportunities to leverage a risk assessment. There's the infection control risk assessment that facilities can do on an annual basis and really bring together partners to evaluate what the highest risks may be, and what mitigation strategies may be. Some of them might be engineering controls, but there are others that are PPE related, ensuring that there's access to the appropriate PPE for what might be coming into a unit, or from an ambulance agency, and what other resources like a chucks, et cetera, might be needed to create that barrier and provide that additional level of protection for what might be coming into a unit or a floor.
Absolutely. Okay, so I just want to get maybe some quick answers here, because I know we're not going to have time for everything. Somebody asked about launderable gowns, and I wanted to mention that launderable gowns can absolutely be rated. If we can go on to the next slide, please, Benjamin. First of all, I just want to quickly say these standard test methods that we threw around some letters here. AATCC is for textiles, and then the NWSP is the non-woven standard procedures, and those are ones for those gowns that are like not a weave. They, as Brooke was saying, they're kind of that spun bound kind of material. I wanted to show here that if you have a launderable gown, it should have a little grid for tick boxes. So rated launderable gowns have to meet the standard for which they claim. So if they say I'm a level 2, they have to meet that after that, at that 50th wash or whatever they claim the number of washes they're good for. So they have to meet that same standard for that. But say it's 50 washes, the 51st, they could fall apart. But for 1 through 50, they have to meet that same standard. So you might have launderable isolation gowns, perfectly reasonable. I think that one of the other questions I have is just quickly about things like seams. So all these different kind of protections, are seams covered? Are ties covered? Like what parts of the gown aren't covered by this stuff, Jill?
Yeah, so the seams are covered in some of the critical zones, and the ties are not covered. Ties are not a critical zone, but seams are, if they're in the critical zone area, then seams also have to be tested, which I find fascinating. You don't really think about the seams being something that is a high risk area, but that's probably the higher risk area on how that is connected together. So seams are covered, ties are not. One thing I wanted to mention about the laundering that I found interesting when we were all kind of talking about this is a lot of this is electronic now too. If you use with isolation gowns or surgical gowns that are laundered, a lot of it is kind of scanned in as they're kind of going through the laundering system, because it kind of horrified me that we were relying on somebody to check these little boxes there, which that is absolutely a method that is used, which scares me to death that's something that we're hoping somebody check marks a box and that nobody misses a date or whatever. But a lot of systems now they're scanning the gown each time they come in, which seems like a much better process. But this process is actually used, which just doesn't seem super reliable. But if you are using a reusable gown system, it's actually something that you may want to check and see, like, what is the max amount that we're washing? How do we know when we reach that amount? Are we scanning? Do we have this little check mark box? Do you ever see check marks showing up on that box? So it was something that I never really knew until this conversation started. So it may be something that you keep as homework for yourself to go back and check.
Yeah, and I will say that many of the gowns, again, please, I don't want anybody to get the impression that we're telling you that you're going to have to go out and make sure your department stocks these, level 3, level 4 gowns. For most isolation, when we're talking about contact precautions for many, many things that are used. And now I know this is really big in long-term care, right? Because there's these extended barrier precautions requirements. Many of the gowns being used will be unrated gowns. That does not mean that they don't offer you the protection that really you're expected to encounter in sort of the day-to-day work of dry fomites being in somebody who's colonized with something, or you've got sort of an environmental exposure. But if you're going to be doing a procedure, or if you're going to be in physical contact with a patient and their body fluids, so I'm bathing somebody, or I'm doing wound care, and I've got all these things I'm touching, then we want to think about adding a layer of protection, whether that's a better gown or whether that's another piece of sort of a supply that can be risk mitigating, like an underpad or a chucks. Can we go to the next slide, please? Because I know we've got a lot of questions and we don't have much time, but I want to talk a little bit about risk assessment. So there are a lot of ways to think about risk. And I just want to talk through a couple, because I think I want people to think about, all right, what am I going in this room to do? Am I going in the room to just take a temperature? Am I going in the room to get a history? Or am I going in the room to do wound care? or to, look at somebody's bottom or whatever else. What can I expect? What are kind of my exposure risks in that? So, as I said, every time I turn a patient, my assumption is there's going to be poo there. But I wouldn't necessarily assume that every time I go in to talk to a patient or give them their dinner tray or, help them up from the chair, that I'm going to be exposed to their body fluids. So I think there's always going to be a little bit of flexibility there. So thinking about what PPE would I want? What would I want to have at my disposal? And maybe you have it with you, but you don't necessarily have to have it on, right? Like I may need a second pair of gloves, as Brooke said, or a chucks. I want to have those with me or have them where I can know I can get to them, but I don't necessarily need them. I don't think we need all gowns for all bed baths. But there are some you definitely need gowns for because you know how physical it can be to have to turn a patient or position them. And then what are our pathogens? Like, what are we worried about protecting ourselves against? And what other tools do I have? So thinking about risk assessment in sort of a broad way. And I think, as Caroline said, there are some good risk assessments out there. I think this is a great challenge for us to put together some that are really intuitive for people, because I think that I love things that can help healthcare workers think about their risk, because I don't think we're always really good about the think first before we step into things. So let's just talk a little bit about risk assessment in these last few minutes. Caroline, I'm going to let you speak first because I think you have a lot to say about risk assessment.
Yeah, happy to jump in, and of course, would love to hear from Brooke and Jill as well. I think, Jill, you provided a really great overview of some of the considerations to ask yourself prior to going into a room or caring for a patient. And I think oftentimes, as Brooke shared, it's sort of after the fact that you're already responding, because the first sort of inclination is to provide care to this person and do what we all are here to do, to provide the highest level of care possible to meet the needs of the patient. In terms of sort of considerations for a risk assessment, there's a lot of good resources out there from CDC and APIC that really walk through some of, the things that would be helpful to consider. What am I going to interact with? Are there potential areas where I might want additional protections because it could escalate into, coming across additional fluids? Are there options to call for help if I need it? And do I have a plan if I do need to ask for additional support? Those are some of the considerations from a risk assessment that I would pull into when reviewing and rounding in particular, to ensure that floors and units have access to the right level of protection to meet the needs, to ensure that healthcare workers are receiving the level of protection needed to provide the highest level of care.
When I talk about risk assessments, which I love talking about doing them, there's a wide variety of ways to do a risk assessment. You can do one that's already written out and it's a tool already provided for you, or you can start from not having one and you just go rounding, looking at what's going on the unit or area that you want to assess. And what I've told people to do is sometimes just do it backwards, find the answers first, and then write the questions later, because you find your answers on what you want to look for, and then you write the questions and reproduce it. Like Caroline said, what body fluids are you going to be exposed to here? Well, you went and you saw it. Well, now write the question later. So you can actually just do your own risk assessments and form them fairly easily by just going and rounding in the space and just spending time there. I'm such a big proponent of spending time in the space and getting to know the workflow, and you'll find the risks and be able to write the questions super easy if you just spend time in the space that you want to assess.
Gosh, I love that idea. I think being in the space and really appreciating how people are doing their job, right? Not just what your job title is, but how are you doing that? And there are a lot of things that influence that, right? We all have different skills and abilities, heights. I mean, good grief. Where I interact with a bed is different than somebody who's a foot shorter than me interacts with a bed. I mean, these are things that are just important to how we do our jobs. I know that we probably have 50 more questions we could try to answer today. I do want to end, first of all, of course, by thanking all of you guys for attending this webinar, and please keep submitting your questions. We are going to try to compile sort of a frequently asked questions that will go with a blog post on the NETEC website. I want to thank Jill Holdsworth for sharing her vast wealth of information about standards. I will also put a little plug in that standards organizations like AAMI, like ASTM, need more end users who are on these committees. And is it always thrilling work? No. But it's interesting and it's important. And if you're just sort of a PPE geek, I really would encourage you to get involved. I also want to say that we had a lot of questions that came in about things like masks. And that is such a huge topic that guess what we're going to cover with our next webinar? We're going to cover just diving into mask standards. And we're going to bring to you another completely geeky mask standard person. Jeff Stoll from ASTM has agreed to join us for this next webinar. So be looking for that shortly. I would guess we'll probably be working on that as we go through the summer. We know there are going to be a lot of questions about masks and mask standards and diving into respiratory protective devices. I'd like to just give you guys an opportunity to say a last word or two, or get whatever's on your mind out there, and then we'll close up today.
Sure. I just wanted to mention, I know we've had several requests for people wanting a resource or a short 1 or 2 pager, and we are working on a document that will try to help educate people to the different levels of PPE and what they maybe look like. So we are working on that. That will be part of the blog post, and we will get that out shortly. And I think that's all I had to add right now. Thank you, everyone.
Thanks, Brooke. Caroline?
Yeah, thank you for the opportunity to present, and Jill Holdsworth for the amazing overview and recap of the changes for PB70. In addition to the resource that Brooke mentioned, we'll also include some resources for risk assessments and some of the opportunities to, pull in the discussion items that Jill talked about, sort of going to the floor, talking with partners, really engaging, understanding workflow, and how to integrate that into a more formal risk assessment that meets the need of your facility.
Thanks. And Jill H.
Yeah, thank you guys for being here and for listening. Loved talking about this, and happy to continue this discussion with anybody who has interest or additional questions. Thank you, guys.
All right, and thank you. On the screen right now are some additional resources, an explanation of the F1670, 1671. And then for those of you who are attending the APIC conference, there's actually going to be a discussion about risk assessment and this standard at the APIC conference coming up in just a couple weeks. And then CDC guidance about extended barrier precautions, PPE donning and doffing. Again, it's not just what we use, it's how we use it. And then we have a whole list of resources for PPE from NETEC. And as Brooke said, we're going to be working very quickly on some printable material that will help give a synopsis of the materials we covered today and serve as a cheat sheet for those PPE levels and levels of protection. So thank you guys so much. We greatly appreciate it. Again, we will try to compile some of these questions in an FAQ that will go out on the blog. And please, if we can go to one more slide, I think we've got all the ways you can reach NETEC here. So if you're looking for more further information, you can reach us at info@netec.org. You could send questions to info@netec.org, and you'll get somebody like us answering them. You can submit technical assistance requests. If you have a question about your PPE ensemble, your donning and doffing, all sorts of things that you might have technical questions about, reach out at netec.org, and we have the ability to get you hooked up with the right professionals that can help answer those questions for you. Thank you again so much for today's presentation, and we look forward to seeing you in a couple months to talk about masks. So thanks again, you guys. All right, bye-bye. Have a great day.